Hey everyone, and welcome. Have you ever had that deep, nagging ache in your joints? You know, the kind that's more than just sore muscles? Well, if you have, you are definitely not alone. Millions and millions of people live with osteoarthritis. So in this explainer, we're going to break down this super common condition. We'll look at what it is, what causes it, and what it actually feels like from the inside out.
So let's just jump right in with that big question. When you feel that ache or that stiffness in your knee, your hip, or maybe your hands, what is actually going on in there? To really get our heads around osteoarthritis, we've got to take a peek inside the joint itself.
Okay, so osteoarthritis is by far the most common type of arthritis out there. And you've probably heard it called wear and tear arthritis, right? Well, that nickname is actually a perfect place for us to start because it really gets to the heart of what's happening.
And you know, the name itself tells us a whole lot once you break it down. Osteo, that means bone. Arthro, that's talking about the joint. And that ending you hear all the time, itis, well, that's just medical speak for inflammation. So, put it all together, and osteoarthritis literally means inflammation of the bone and joint. See? Simple as that.
So where is all this happening? Well, in a healthy joint, the ends of your bones are covered with this amazing stuff called cartilage. It's super smooth, it's slick, and it's strong. Think of it like a natural shock absorber, a perfect cushion that lets your bones glide past each other without any friction. But with osteoarthritis, that protective cartilage, it starts to wear down. It gets rough, and over time, it just wears away. So that leads to the next big question, right? Why? What causes this super important cartilage to start breaking down? Well, it's almost never just one single thing. It's usually a mix of different factors that put stress on our joints over many, many years. The biggest factor, a lot of the time, is simply age. I mean, the longer we use our joints, the more wear they're going to have. Things like an old sports injury or a job that has you doing the same motion over and over, that can definitely speed things up. Carrying extra weight puts a ton of constant pressure on joints like your knees and hips, which can really wear down that cartilage faster. And finally, genetics plays a role. Yep, some people are just naturally more likely to develop it than others.
Okay, so we know what's happening inside the joint, and we know some of the reasons why. But what does all of that actually feel like on a daily basis? Let's talk about the symptoms.
If we look at this joint again, you see that glowing spot? That right there, that's the perfect picture of the experience of osteoarthritis. It shows the pain, the swelling, that deep inflammation that kicks in when the cartilage cushion gets thin and bones might even start rubbing together. It's the visual for that feeling.
And this whole experience shows up in some really recognizable ways. The number one symptom is a deep, aching pain in the joint, especially when you're moving. You might also feel really stiff. That's a big one. And it's often way worse first thing in the morning because things can kind of settle and build up overnight.